today?
I'm good. How are you?
Good. My name is Julie. I'm going to be your nurse today. Can you tell me why you're here?
I'm here for my yearly history and physical.
Okay. Okay, great. Well, we'll get started in just a moment then.
Okay.
Okay, thank you. So during my general survey of the patient, I noticed that her appearance is appropriate with her stated age, which is 47. Her skin tone is even and pink. I don't notice any lesions anywhere. There's no obvious physical deformities. Her nutrition appears to be adequate. Her speech is clear. She articulates her words very clearly. Her native language appears to be English. Her mood and affect is positive and appropriate for her the responses to her questions. Her hearing, she's not asking me to repeat any of the questions that I've asked her, so her hearing appears to be intact. Her level of consciousness, she's awake and alert. She's answering questions appropriately. She's cooperative with the assessment. Her posture and position, her posture is erect. Her position is relaxed. She doesn't appear to be tense. Her facial expression does not relay any tenseness or anxiety. Her mobility, she did not use a cane or walker when she entered the office. Her gait was even and evenly spaced. And her personal hygiene is appropriate with her stated lifestyle, and it's also appropriate for the seasons. And now we'll get started on the assessment. Okay, so now we'll get started on the assessment part. I'm just going to look at your hands, if you don't mind, and just assess your skin. It's warm and dry. Your nail beds, I don't notice any clubbing at all. Your capillary refill returns to normal within 3 seconds. I'm just going to look at the backs of your hands. Okay. Your skin tone, again, is even. I'm going to just pinch your skin a little bit just to check the turgor. Sorry. And that does return to normal very quickly, within 3 seconds as well. I'm just going to palpate your scalp. Is there any tenderness here when I'm doing this?
No, not at all.
Okay, I don't notice any bruises or any lesions. Your hair appears to be evenly distributed. It's very thick. Your head is normal cephalic. It's round. Again, I don't feel any bumps, lesions like that, anything like that anywhere. I'm going to palpate your temporal artery. Any tenderness there when I do that?
No.
Okay, your pulse appears to be strong. Your face is symmetrical. Your nasolabial folds are equal and symmetrical. Your palpebral fissures are symmetrical. And the sides of your mouth also appear to be symmetrical. Now I'm just going to get you, place my hands here and get you to open your mouth and close it. And close. One more time. Okay, I don't notice any crepitus. I don't notice any limited range of motion there. I'm just going to palpate your sinuses now. And you just tell me if you feel any tenderness at all.
Okay.
These are your frontal sinuses. And I'm just going to do your maxillary. No tenderness?
No.
Okay, all right. Okay, great. We'll go ahead and continue with the rest of the assessment then. Okay, so now we're going to do the eye exam. What I'd like to ask you to do is take this index card and place it over your right eye.
Okay.
And I'm going to come behind you and wiggle my fingers, and I just need you to tell me when you can see my fingers in your visual field.
Okay.
Okay, over your right eye.
No. No. No.
Okay, we'll do the same thing over the with the card over the next eye.
No. No. No.
Okay. All right. Your visual field appears to be intact. The next thing I'm going to do is I'm going to take this light and I'm going to check your. I'm going to shine it on the bridge of your nose, and I'm going to check your corneal light reflex. Just focus on me. Okay, the light reflex pinpoint is equal on both pupils in the same location. Next thing I'm going to do is check your extraocular muscles. I'm just going to have you focus on my finger, and if you could just follow the movement of my finger without moving your head. Okay, good, great. Your extraocular muscles appear to be intact. I'm just going to examine your external structures. Can I get you to lift your eyebrows? Your eyebrows appear to move symmetrically, and if you could close your eyes for me. Your eyelids meet when they are closed, and your eyelashes appear to be evenly distributed. The next thing I'm going to do is just look at your internal structures in your eye. And I'll look at each eye. And we're going to come a little closer. Okay, and do the same thing on the other side. Okay. Your optic disc, the margins are very distinct. It appears to be a creamy white, creamy yellow, orange color. The vessels, I don't see any interruption in the blood flow. Your general background is a reddish brown color. The next thing I'm going to do is have you focus on the wall here. I'm going to bring my finger into your field of vision. I just need you to focus on that. I'm just going to check your accommodation on that.
Okay.
So if you could focus on the wall. And now focus on my finger. On the wall behind me again. And on my finger. Okay, alright, great. I'm going to check your, just I'm going to pull your eyelids down. If you could look up for me. And I'm just going to pull your eyelids up and just look down. Okay. And I'm going to check your cornea from this side. This shouldn't be as bright. Do the same thing over here. Okay. I don't notice any cloudiness at all in your cornea. Your accommodation, you were able to refocus your gaze from the wall to my finger. Your pupils are equal, reactive, and responsive to light and accommodation. They're round and regular. And so now we'll move on to the next part of our assessment. Okay, so now we're going to continue with our assessment of your ears. I'm just going to look at your external structures, and just tell me if you have any pain at all when I tap it here.
No.
Look at the other side. Any pain on this side?
No.
Okay. Your skin tone is even and consistent with the rest of your facial features. Your ears are placed midline. They're even and consistent bilaterally. The next thing I'm going to do is look at your internal ear. And also just let me know if you have any pain here at all. Okay, do the same thing on the other side. Okay. Was there any pain during that?
No.
I do notice that you have a small amount of cerumen in each ear, but very small though. I didn't notice any redness or discharge, anything like that. The next thing that we're going to do, your tympanic membrane is pearly gray. The next thing we're going to do is perform a hearing test. I need you to take your finger in your this ear, and I'm going to cover my mouth and repeat say three words. If you can just wiggle your finger, and I'll have you repeat the words after I say them.
Okay.
All right.
Airplane. Football. Ping pong.
Okay. Do the same thing on the other side.
Airplane. Football. Ping pong.
Okay, great. Now we'll start on your nose. Your nose is in line. I don't notice any lesions or swelling, any tenderness here when I do that at all. Okay. And I will, with a new one of these, I will look at sure internal structures of your nose. Just going to pick up a little bit here. And the same thing on the other side. Okay. I also want to check the patency of your nostrils. If you could just take one finger and cover one side and breathe in. And same thing on the other side. Okay, thank you. Your nasal passages appear to be patent. Your nasal mucosa is red, moist. I didn't notice any lesions or everything is intact. The next thing we'll do is we'll go onto your mouth. And I'll just get you to open your mouth. And oh, sorry. I'm going to use this light to see. Okay, just open your mouth. Say, ah. Oh, okay, now I noticed you had your tonsils removed.
Yes.
How long ago was that?
I was at age 10.
Age 10? Okay. I'm just going to continue and look at the rest of your mouth. And your hard palate is a whitish, pinkish. I don't notice any lesions. If you could stick your tongue out for me. Your tongue is midline. Next thing I'm going to do is I'm just going to feel your nodes, your lymph nodes. I'm so sorry. Your lymph nodes. Okay. So start here. And just let me know if you have any tenderness at all. No tenderness there either? And notice that your trachea is midline. Just leave it there. Okay, I'm going to get you to shrug your shoulders. I'm just going to count right here. Okay, last thing I want to do is just check your range of motion. If you could bend your neck forward and back and center, and then if you could go side to side. Okay, I don't notice any range of motion issues at all. You seem to be able to move. I'm just going to check your muscle strength now. If you could turn your head that way. Okay, and again this way. And down and back. Okay, and your muscle strength appears to be equal bilaterally and intact as well. And last thing I want to do is I'm just going to check your carotid pulse. I'm just going to get my stethoscope ready. Okay, and I'm just going to palpate first, each side. And your pulse appears to be strong and regular. And because of your age, I am going to check just to make sure there's no bruise or abnormal sounds at all. Just place this here. Take a deep breath and hold it. Okay, I'm going to do the same thing to the other side. Deep breath. Thank you. Okay, thank you. I don't notice any abnormalities on either side there, so no bruise noted. Okay, I want to check your thyroid gland. I'm going to have you take that glass of water.
Okay.
I'm going to stand behind you, and first I'm just going to palpate your thyroid gland. And okay, if you could take a deep drink of water for me. And swallow. Sorry, can you do it one more time, please? Okay, great. I don't notice any enlargement at all in your gland. Was there any tenderness at all?
No.
Okay. All right. Thank you so much. And we'll open it up, box. Okay. Okay, now we're going to assess your chest and lungs, the posterior section. I'm just going to raise your shirt and look at your skin. Oh, sorry. And I don't notice any abnormalities. You do have some freckles here. Have those always been there?
Yes.
Have you noticed any changes in them? in the
No,
past
not
few
at
years?
all.
Okay, all right. So the next thing I'm going to do, I'm just going to note any asymmetrical areas. Your shoulders and muscles appear to be symmetrical. Next thing, I'm just going to ask you to take a deep breath in and exhale. And your chest expansion appears to be symmetrical. Let me know if you feel any tenderness here.
Okay. No. No.
Okay, all right, great. I'm just going to ask you to repeat the word 99 while I place my hands in different areas.
Okay.
Okay, if you could say 99.
99. 99. 99. 99.
And one more.
99.
Okay, I do feel vibrations on each side of your chest, bilaterally. The vibration is equal. And the next thing I'm going to do is I'm going to have you bend your head forward slightly. And I'm just going to feel down. And just let me know if you have any tenderness at all.
Okay.
Any tenderness there?
No.
Okay, now I'm just going to go down your spine here. And again, just let me know if you have any tenderness. I'm not noticing any lumps or abnormalities, no lesions or anything. I do want to mention that your skin does appear to be warm and dry. Again, with no lesions noted. The next thing I'm going to do is, I'm just going to get my stethoscope ready, and I'm going to listen to your breath sounds, and then after that I will just do some percussions. Okay, I'm going to get you to just lean forward slightly, and if you could just take a deep breath in when I ask and exhale when I ask. I'll my stethoscope first. Okay, deep breath in and exhale. Again. Again. I don't hear any adventitious breath sounds. Your breath sounds seem clear. Now I'm just going to percuss down your back, and just let me know if you have any tenderness while I do this. Now I'm going to ask you to inhale, and I'm just going to listen right here. Just take a deep breath in for me. And just hold it. And we're going to have to do that over because I didn't have a pen and ruler there. Okay, I'm just going to ask you to take some deep breaths in while I palpate. Deep breath in. And hold it. Exhale. Okay. And I'm just going to do the same thing on this side. After you do a deep breath in, take a deep breath in. Okay, one more time while we exhale. And I'm just going to measure the difference here. Okay, and your diaphragmatic expansion is about 4 centimeters. And next thing I'm going to do is listen to your heart sounds. I'm just going to, again, I'm just going to move to the front, and I'm just going to ask you to lean forward slightly. And I'm just going to listen to your heart sounds here. And also on here, I'm going to get your radial pulse. And just for the sake of time, your pulse is regular, it's strong, and your heart rate is 68. I did note your respirations at that time also, and your respirations are 18. And they are even and deep and unlabored. Okay, now I'm just going to assess your anterior chest. I'm just going to feel your skin. Your skin is warm and dry to the touch. Your skin tone is even. Again, I noticed no lesions or any abnormalities. The next thing I want to do is just listen to your breath sounds. And I'm going to warm my stethoscope before I do that. And if you could just take a deep breath in and out. Again. In, in, out, in and out, in, in, in. I'm just going to listen to this one too. In, out, in, and out. Okay. Didn't hear any adventitious breath sounds. Your lung fields appear to be clear. Next thing I'm going to do is I'm just going to place my hands and ask you to repeat the word 99. Okay. You can say 99.
99.
Again.
99. 99. 99.
Okay, I did hear the vibrations equal bilaterally. Next thing I'm going to do is just percuss. I'm going to use the same pattern that I did when I was listening to your lungs. And just let me know if you feel any tenderness. Okay, was there any tenderness there at all? Okay, all right. Do you perform monthly, or do you perform breast exams?
Yes, I do.
How often do you perform those?
I try to do those monthly.
Is there a particular time that you perform your exam?
I try to do it right at the end of my cycle.
Okay, okay, that's great. Another day that would be a good time to do it would be the 4th or 7th day of your monthly cycle. That is another time when your breasts are less congested, so you can feel a little bit better.
Okay.
When was your last mammogram?
6 months ago, with my
Okay.
July visit.
Oh, okay, great. And I'll have some pamphlets that I can hand out to you at the end of our assessment
Okay,
to help
thank
you
you.
with that as well.
Mhm.
Okay, now we'll get you ready and we'll listen to your heart. I do have to reposition you in the bed, so we'll do that. Okay, before we continue, I just want to do some range of motion exercises on your assessment on your upper extremities.
Okay.
If I could get you to put your arms out in front of you and flex your wrists down and up. And I'm just going to have you, with my hands against you, if you could flex up and down. Okay? Bend your arms up. And I'm going to have you bend your arms out to the side, straight up, and behind your head. And now I'm just going to test your muscle strength. If you could pull against my arm. Okay? And this way. And then arms out to the side. Raise your arms up. Okay, great. Your muscle strength appears to be intact, and I don't notice any limitations in your range of motion. And now we're going to get ready to listen to your heart sounds. Okay, I have you positioned in a 30-degree angle now, and what I'm going to do to start, I'm just going to shine my light across your chest and see if I see any abnormal lumps or masses. And I don't notice anything there. The next thing I'm going to do is I'm going to use the bell of my stethoscope and listen to your apical pulse, your apical impulse. Your apical impulse is regular and strong. The next thing I'm going to do is I'm just going to place my hands on your chest and see if I see feel any abnormal pulsations or anything. Okay, I don't notice any abnormal pulsations there. If you could roll onto your left side for me, I'm just going to use the bell of my stethoscope to listen for any abnormal heart sounds. Okay. Okay, I don't hear any abnormal heart sounds at all. So if you could roll back onto your back for me, I'm just going to inspect your abdomen. And I'm going to use my light again here. I'm just going to shine across your stomach and see if I see any abnormal pulsations. I don't see any abnormal pulsations. Your umbilicus is midline and inverted. And the contour of your abdomen is flat. Next thing I'm going to do is I'm just going to listen to your bowel sounds. Okay, your bowel sounds are active. Cut and paste here. Next I'm going to listen for vascular sounds. I'm going to listen over I'll listen over the aorta. And I'm just going to feel the aorta here. Now I'm just going to percuss. I'm just going to listen to your abdomen. Just going to do that in a clockwise motion. And now I'm just going to see if I can estimate your liver span here. And I'm also going to make sure that I have my ruler and my pencil handy so that I can now just a little more here. And there. And just measure that, and your liver span appears to be approximately 3.5 to 4 centimeters. I'm just going to feel, see if I can palpate here. Do you have any tenderness there at all?
No.
Okay, do the same thing on this side. Any tenderness here?
No.
Just going to do kidneys. The next thing to do is just some light palpation. And again, just let me know if you have any tenderness at all. Any tenderness during that?
No.
Okay, and I'm just going to go a little bit deeper this time. No tenderness there?
No. Not at all.
Okay. I wasn't able to palpate your spleen or your liver, and that's normal. I was able to feel some pulsations in your aorta. Couldn't palpate either kidney, but again, that's normal. You have active bowel sounds in all 4 quadrants. And I didn't hear abnormalities in over any of your iliac, renal, aorta, or your femoral arteries at all. And then the next thing we're going to do is just move into a range of motion exercise with your hips and ankles.
Okay.
Some legs. Let's see. Okay. Okay. So then we're going to just continue with the examination of your lower extremities. I'm just going to feel, excuse me, the temperature of your skin, which is warm and dry. I'm just checking for any swelling or edema. I'm going to ask you to bend your knee, and I'm just going to get your popliteal pulse. Okay, same thing on this side. Your popliteal pulse is faint, but that's a normal finding. That's not anything unusual. Now I'm just going to get your dorsalis pedis, which I would rate as a 2 bilaterally. Your posterior tibial is a 2 as well bilaterally. I didn't notice any swelling. I'm just going to check your range of motion in your hips. If you could just raise this leg straight up and down, and then bend your knee to your chest. Okay, great. Same thing on this side. Leg up, and then knee to chest. Okay. If you could flex and point your toes. And then I'm also going to ask you to do this just against my hands. And then down. And then if you could flex and extend your toes. Okay, great. I'm just going to inspect your feet real quick. Okay, I don't notice any lesions or any abnormalities there. The next thing I'm going to ask you to do is if you could sit up and dangle your legs over the side here. In the video. Okay. And we're going to check your reflexes. Okay, so now I'm just going to get you to take this leg and bend your leg and take your shin, take your heel and run it down your shin. And if you do the same thing on the other side also. Okay, great, thank you. If you could just sit up and dangle your legs over the side here. And we're going to check your reflexes. Check your brachial reflex. And your tricep. Okay, same thing on this side. Let's check your brachial first. And your tricep. And just relax your arm down, and I'm going to go back and check here. And here. Okay. Excuse me, I'm just going to check your quadricep reflex. Oh, sorry. I'm just going to check this one as well. And I'm going to check your Achilles. And this may take a little bit, but I'm just going to run this down your foot. Okay, and it's negative for the Babinski side. All your other reflexes appear to be intact. If you could just stand here, and I'm just going to check the fronts of your legs. They are symmetrical. They're equal in size. There's no lesions noted. If you could just turn around and just let me check the back. Again, they are equal in size. Skin tone is warm and dry. The skin texture and tone is even. I don't notice any varicose veins. And if you could just have a seat back there. And we're going to check, I need to check the vibrations in your feet. Just tell me if you can feel this.
Yes.
The next thing I'm going to do is just test your sensation. This is a sharp feeling, and this is dull. And just close your eyes if you don't mind, and tell me what you feel.
Sharp. Dull. Sharp. Dull.
And do the same thing here.
Dull. Sharp. Sharp. Dull.
And one more time.
Sharp. Dull. Sharp. Dull.
Okay, great. Now I'm just going to take, just test your sensation for light touch. You could close your eyes for me again and tell me what you feel. Tell me when you feel this on your thighs.
Now. Now.
Okay, great. Now I'm going to ask you just to extend your hands. We can do one at a time. I'm sorry. And I'm going to place an object in. I'm going to ask you to close your eyes. I'll place the object in your hand, and if you could identify it for me.
Okay. A key.
Okay. And your other hand?
Paper clip.
Okay, great. Now, if I could get you to stand again. And if you could just walk slowly towards the end of the wall, and then turn and head back. Right here. Okay, great. And let me get over here so I can watch you a little bit better. Okay. And now if you could walk heel to toe towards the wall and then turn around. And then, yes, heel in front of toe. There you go. And turn. And then if you could stand on your tiptoes and just take a few steps for me. Great, and then turn and just walk on your heels. Okay. I don't notice any limitations in your range of motion. Your gait is even and steady. You said you don't use any kind of assistive devices at home.
No.
Okay, I'll let you go ahead and sit back down there. And I'm sorry, not sit back down. I'm going to stand
Okay.
behind you. And if you could just bend and touch your toes. And I'm just going to look at your spine. Okay, and come up. And I'm just going to put my hands on your waist. And if you could turn to the right and to the left. And then bend backwards and up. And then side to side. Okay, great. And you can go ahead and have a seat now. Okay, well that concludes our assessment. I didn't find any abnormalities at all. I did have to say I would give you some pamphlets on your way out for the self-breast exam, so I'll go ahead and do that then. But can I do anything else for you today?
No, I think that's everything.
Okay, great. Well, thank you so much.
Thank you.